Welcome to the Hamakom online benefits meeting. We are going to go over your medical, dental and vision plans. In this meeting, I will go over the most commonly asked questions about those plans. Before we begin, you'll be happy to know that your medical plans are staying with Anthem and Kaiser for the upcoming year. Your dental and vision plans are staying with Emeritus as well. Did you know that you can compare the medical plan options on your portal, on your screen, or as a spreadsheet? Click on the Compare Plans button to see more. Here is an example of what the comparison will look like for you when you compare the plans on screen. This is a great way to look at the benefits of each plan. You can see the deductibles, co-pays, and other important plan information here. Or you can always click on the Export button at the bottom of the comparison screen to view the plans in a spreadsheet format. Your employer is continuing on with both Anthem and Kaiser this year. However, you may want to look up your current provider and make sure that they participate in the plan that you are choosing. Your Anthem HMO plans use two different HMO networks, Vivity or California Care HMO. If the provider that you want to utilize is at UCLA, Cedars or Providence Facey, you want to choose Vivity in the search, or if your provider is not within that network, you can look in the California Care HMO network instead. If you choose a PPO plan this year, you do not need to choose a provider. But you should keep in mind that even though you can see out-of-network providers on the PPO plan, you will always receive a lower cost from utilizing an in-network provider. We have included provider search instructions in the web portal to help you locate local providers. If you are an existing member, you do not need to update your provider in the EASE system. If you want to change your HMO provider, you should make this change directly with Anthem. However, if you are a new member or if you are moving from Kaiser to Anthem this year, you can indicate to us who that provider is at the bottom of the enrollment screen in EASE. We just need their enrollment number. If you do not wish to choose a provider, one can be auto-assigned to you. And if you are enrolling in Kaiser this year or moving to a Kaiser plan, you only need to contact the facility that you want to go to when you need services. If for any reason you get stuck, you can always reach out to us if you have any questions.
The Anthem, Vivity Gold HMO 25, and the Kaiser Gold 250 are two of the most popular gold level plans. Gold level plans usually have lower deductibles and lower co-pays than many other styles of plans. Let's look at these two options to see how they compare. The Kaiser 250 plan has a $250 deductible for an individual and $500 deductible for family, while the Anthem Gold Vivity 25 has no deductible. The Kaiser plan has a $35 copay for the primary care doctor and $55 copay for the specialist, while the Gold Vivity 25 plan is slightly less at a $25 copay for the primary care doctor and a $50 copay for the specialist. Hospitalization under the Kaiser plan is $600 per day for the first 5 days after the deductible. 5 days could cost you just over $3,000. Whereas it is $500 per day or $2,000 for 4 nights under the Anthem plan. It is $335 for an outpatient surgery under Kaiser versus $500 under the Anthem plan. Please note that the deductible applies to everything on the Kaiser plan marked with an asterisk. The emergency room at Kaiser is $250 after the $250 deductible. And Anthem is $500 in the emergency room. Prescriptions for both plans are based off of the tiers 1 through 4. Under Kaiser tier, 1 drugs are $15, tier 2 and 3 are $40, and tier 4 are 20% up to a max of $250. Under Anthem, the drugs are listed in tiers 1 through 4 as well. Tier 1, drugs range from $10 to $20, Tier 2 drugs range from $50 to $60, Tier 3 drugs range from $125 to $135, and Tier 4 drugs are $250. Lab tests are a $35 copay at Kaiser and a $25 copay at Anthem. Complex imaging is subject to the deductible at Kaiser and then $250, while it ranges in price from $100 to $250 at Anthem, depending on where the service is performed. Once you have finished with your medical plan selections, you will be able to look at your dental options. Your dental plans are continuing with Emeritus Insurance this year, and the rates have been updated in the system for both the 1,000 and 3,000 Fusion plans. If you want to make a change to your dental coverage, this is the time to do it. If you did not choose dental last year, or if you want to move from one PPO to another, you can make that change now. If you choose to enroll in the PPO, you do not need to choose a dentist, but it is important to note that you will get the best benefit if you use an in-network dentist. If you know that you will go to an out-of-network dentist, you will be better off on the 3000 plan as it has a higher level of reimbursement to out-of-network providers. It is easy to remember which plan has more benefit because the numbers 1000 and 3000 refer to the amount of benefit you can use each calendar year. PPO dental plans cover you based on the type of service you need. Type 1 services, like cleanings and exams, are covered at 100% in-network. Type 2 services, like fillings and endo and perio work, are covered at 70%. In-network and major services like bridges and dentures are covered as a Type 3 service at 50%. The 3000 plan not only has more benefit, but it covers you better if you need more work done. In-network, Type 1 services are covered at 100%. Type 2 services, however, are covered better each year you stay on the plan. If you stay in network, in year 2, Type 2 benefits are covered at 90%, and in year 3, they are covered at 100%. Type 3 services are covered at 50%. If you have more work that needs to be done than usual, you would be better off on the 3000 plan. And if you are planning to see an out-of-network dentist, the 3000 plan pays a higher rate than the 1000 plan does to the out-of-network providers. There is one last thing that I want to mention before we move on to the vision. Both of the dental fusion plans from Emeritus have a vision benefit of $100 that you can use towards eye services. All you have to do is send in the claim to them. You can use this benefit for an exam or even to help pay for frames alongside the vision plan.
Let's look at your vision options now. You have the choice of 2 vision plans that are labeled as a high and low vision plan. Both of these plans use the VSP network and provide you with the benefits to get an exam, lenses, and frames every year. It is a $10 copay for the vision exam to a VSP provider, $25 copay for your single vision, bifocal, or lenticular lenses. Other features such as transition lenses or scratch resistance could cost extra. Once you have paid the $25 copay, you'll receive $150 to spend on the low plan towards frames or $180 on the high plan. And just to make sure that you did not miss this, you can also use the Fusion benefit on the dental plan to get more of your frame covered if the frame benefit is not enough. If for any reason you get stuck or if you need any additional help, feel free to reach out to us at 818-883-3282 or send us an email at service@lafinservices.com. Thank you for your time today. I hope that this video has given you a great overview of the open enrollment process.